May is Mental Health Awareness Month, and so we are continuing the conversation this morning with our ABC 15 Health Insider, Dr. Shad Marvasti. And today we're going to talk a little bit about how common mental health issues are, because I think when you're in the midst of something like depression or other forms of mental health illness, it feels very lonely, Dr. Shad.
Very common. In fact, more than 50% of adults will be diagnosed with a mental health illness or disorder at some point in their lifetime. And 1 in 5 Americans will experience a mental illness in any given year. And 1 in 5 children either currently or at some point in their life have had a seriously debilitating mental illness. So it's very common. And unfortunately, when we don't get the help we need, and again, I can't emphasize enough how important it is to destigmatize it, normalize it as something that we all face like any other challenge, like getting sick from any other cause. Because when we don't normalize it and we don't get the help we need, that's what leads to this really bad statistic of suicide as being the 10th leading cause of death across the United States.
While it is very common, it still feels lonely, and loneliness in and of itself is a mental health issue.
It is. And I think people don't realize how much of an impact loneliness has. In fact, research has shown that loneliness, living alone, and poor social connections are as unhealthy for you as smoking 15 cigarettes a day, and worse than being obese. So diseases that come from loneliness include heart disease, dementia, obviously depression, and loneliness itself is linked to an increased risk of death at any given time by a whopping 29%. So it's huge. And we've seen more loneliness during this pandemic than we've had before. And we're actually seeing that on highest rates in young adults. So, looking at that as a big mental health challenge in terms of making sure that young adults feel connected.
Yeah, I think that's something that so many people can relate to over the pandemic. And certainly we can make connections to some of the incidences of suicide. So the big question is, what do we do with that? How are we supposed to rebound from that?
So what we need to do on the prevention end is we need to continue to keep those ties strong socially. If you have friends, relatives, keep those ties strong. Use the technology we have, even if you're isolated geographically. Do FaceTime, do video chats, talk to your close friends at least once or twice a week. Join groups and organizations of like-minded folks, whether it's a book club, soccer, physical activity groups that are out there, different meetups, attend community services. If you're a part of a faith community, actually being a part of a worship service actually is protective and helps to address loneliness. Say yes to those invitations, right? When you're invited to connect with friends and family, don't just kind of sit at home and watch Netflix, right? Volunteering, or developing a hobby with friends, like cooking or getting together with people just to have a game night, right? Any and all of these things. And really just consciously investing those meaningful, authentic relationships in places around the world where we see people who are centenarians living well into their 90s and early hundreds, very healthy. They have a core group of friends that they connect with in a meaningful way throughout their life.
It's amazing what a conversation can do for the soul and clearly for your mind as well. So we'll continue these conversations about mental health as we move through the rest of this month. And as always, you can find resources and more of these stories on our website. We have an entire section dedicated to it, abc15.com/mental health. Dr. Shad, we look forward to the next conversation.
Thank you.